nation needs to see some love, peace, and unity. I look out my window and it just ain't there. We need to lead by example, show somebody cares. The big ballers, the shot callers, we still got to care for our sons and daughters. With all of this madness that's going round, we still got to find some solid ground. So get down.
WISC TV editorial with editorial director Neil Heinen.
This is always a good time of year to reflect on the good stuff, and we'll try to do that over the next week or so. And we start with a nod to WISC anchor Charlotte DeLeste for her terrific Do Something Good stories throughout the year. They have inspired us. But today we recognize the Meadowood Health Partnership, which last week officially opened the Meadowood Health Office. This new facility will offer healthcare support services to community members and is the result of a collaborative effort by groups including Kids Forward and Race to Equity, Today Not Tomorrow, and Access Community Health. This is what citizens do. This is an example of the work of citizens we've been promoting all year. Citizens naming the values they share and the problems they will solve together. Culturally competent healthcare is a great example of that work.
Nice to see you all here today. I'm Ken Loving. I'm a physician and the CEO at Access Community Health Centers. And I'm very honored to be here today to not only recognize Sheray Wallace, but also to kick off the Meadowood Community Health Office and its expanding work in the community. I've been privileged to know Sheray for a number of years, and I feel like we share a kinship in terms of how our organizations have gotten started. And when I think about Access Community Health Centers, we're now a large organization in multiple areas in our community. But we started out a long time ago in the 1970s, and I wasn't here for the beginning of that. But we started out because there were community members that cared about healthcare and that wanted people to get healthcare who weren't getting it. And when I think of the work that Sheray is doing right now, what she is doing is she is reaching out and helping people understand that there can be resources for them, even when they're not readily obvious or readily available. Sheray is filling a need in the Meadowood community that should be an example for communities across Dane County, where people can connect and learn about services and understand ways that they can be healthier, that their families can be healthier, that their children can succeed in school, and that the adults of the community can succeed in the workplace and with their families at home. And for that, I think we need to recognize the importance of Sheray's work. We all need to support it as effectively as we can. And hopefully this project will grow to serve many people in this community and really be a model for care across our communities in Dane County. Thank you, Sheray.
Thank you, Ken, for those remarks. My name is Betty Banks, and I'm the Executive Director of Today Not Tomorrow Incorporated. We are a nonprofit that work with families, providing them with information, education, and resources. And it is with a lot of pride that I stand here today to be a part of this press conference to introduce the Meadowood Health Community Office. After surveying residents, hosting health fairs, building a team of partners, and becoming a certified community health worker, Sheray knew that it was time to provide a neighborhood-based model of healthcare. And she and I had been talking about it. We actually came together a little more than 3 years ago through the Race to Equity Community Ambassador Program. And we have probably talked or met every day for 3 years about this community and what it is that families and individuals need. And I have watched Sheray grow and learn and look at what it is that she needs to do to be able to improve her work. I think that she has, through her work with the Race to Equity as a community ambassador, she realized, what it was that community members and residents wanted. And I'm also privileged to work with her. With the Today Not Tomorrow Family Resource Center, she is one of the collaborative partners. And we provide support and information education for families. One of the other things that Sheray does, among many, is that she has a neighborhood-based baby's closet. And she provides baby items for those families who, can't afford certain things. And she does that through the Today Not Tomorrow Project Babies program. And we were really, really happy when she agreed. We had been talking about wanting to pilot a neighborhood-based babies closet in along Sheray. So it is with a lot of pride and that I will introduce you to Sheray. You all already know her, and she'll talk about the work that she's doing.
Thank you all for coming to this wonderful occasion. I love the work that I am doing that provides information, education, and resources to the residents of Meadowood so that I can build on their strengths and overcome any of their challenges that they may have. When someone comes into the health office, I find it my mission to be a bridge between community members and healthcare services. My role is to strengthen existing community networks for care, provide community members with social support, education, and facilitate access to care. My role that I will be doing in this office will be care management, caseworker, community, being a community health worker, community liaison, patient navigation, and peer coaching. I'm a peer coaching. I do diabetes training on Wednesday night, and I am the front line to your public health work. Thank you. And wait a minute. I also want to support everybody here, everybody that I reached out to come here, made a difference and made this happen. First, Race to Equity, Erica Nelson. You didn't come to this community with your idea. You helped me build on what I knew the people of my community wanted. Everybody comes with a program, but you came with something different. You built me to be able to, and supported me to be able to do all the work that I do. And you allowed me to understand the real, the equity, what it meant, and what my people in my community needed. Thank you, Erica. Thank you, Mr. Levin, for giving me the opportunity to meet with you, to form the relationships that we have formed, and to say that you're going to support me, and I know you will, because whenever I call, you're always there. And Michelle, thank you so much for always listening to any doubts or anything that I have. And Helene, I love this lady. Helene Nelson. This woman, I deal with housing issues. And Helene, long-time social worker, Sheray, and she supported me and our community when people were sitting out, being evicted on the street. Helene Nelson and I and Orchard Ridge made it possible, along with Joining Forces for Family. And United Way, thank you. Thank you for giving me an opportunity that many grant. People like me, when I came into this work, I didn't know about the grant part, how you do it. I came because I like what I was doing. I felt needed. This is all important, and the support that you all gave me helped me here today. Thank you, Tia. Thank you, Angela, for always being supportive. Tia, for being my collaborative partner, and Today Not Tomorrow resource, and the lady behind the camera, Jean. Thank you for helping my community, providing Pampers, baby items, support that you do in our community. And public health, you know, y'all might as well, I won't say hurt me because then it'll take away from me. But thank you for your support. I really like that. And to Stephanie, Mike Hansen, and the Madison Police Department, thank you, because y'all done seen me in many faces. And for you all to support me, that means so much to me. And for this lady here, come here, Alex. Always having her door open, always being so special. And Amanda, come here, because this is about us and our community. Always being here for me, the community, the kids, always making things happen. You are special, both of y'all, to be a public library. Because when I was growing up, you had to be quiet when you were in a library. I really want to, and to my Meadowood Association, I love them. If every association in the city of Madison was like the association that we have in Madison, in Meadowood, we can imagine Madison being really good. Thank you. Thank you. I don't even know how I did this. To Betty, for dealing with me for 3 years, every day. I mean, when I first met this lady, she always, certain people, well, I call Betty and she don't answer. I said, well, I call Betty and she answers all the time. And I call her every day. This is the historian. And she can add this up under her list of things that she has given Madison. This lady loved the kids. And she loved to see people grow. And she know the ins and outs of how the dynamics of Madison, Wisconsin is, and how you navigate the system. And I learned from the best. And I could just see, they said, what do you see in 5 years? What I see in 5 years, you see that library sign say Meadowood Library, I see community health worker.
Following the Sheray Wallace is a hard thing to do, but that's my task this morning. I'm Eric Nelson. I'm the director of the Race and Equity Project for Kids Forward. And I think Dr. Loving and Ms. Banks and Ms. Wallace articulated the value of the Meadowood Health Partnership. And I say this now, I only have a few thoughts to add, but actually this might be a little more long than that. So, first and foremost, the Meadowood Health Partnership is undoubtedly grounded in Ms. Wallace's genuine care and understanding of her community, which in my opinion is the key ingredient to its early success. Second, it is a community partnership that to a great degree already utilizes existing resources and in-kind contributions to address the needs of the community collaborative. It does not exclusively rely on one grant, but rather pools from a variety of sources to create a low-cost and efficient and effective local response to ever-present challenges in communities of color. Moreover, this partnership and Ms. Wallace's role in it demonstrate that there is a critical need for both informal and formal relationships in advancing any grassroots level change and progress. Trust is not built through a program, but through and by individuals and relationships. There is real power in connecting with and lifting up grassroots leadership for improving individual and family well-being, but it is also critical in building the political will and advocating for systemic policy change. In other words, there is no prescribed formula to change and improve lives, but what is evident from Sheray is that it requires passion, commitment, and a deep knowledge and understanding of the needs and challenges of the folks we are working for, on behalf of, and with. This is a project and a health-based initiative that is born and rooted in grassroots leadership, which is seamlessly integrated with policy and best practices. It is a bridge between those in need of greater opportunities, network, and care to a more comprehensive preventative health services, but also a bridge built on and out of trust to systems and institutions that have often failed communities and individuals of color in particular. On a more personal note, I've known Sheray since she became a community ambassador in 2013, and since then I have observed nothing short of a tireless drive to be an advocate and help her neighbors by bringing her experiences, talents, and knowledge to the table. Because of her, this partnership exists and is a true culmination of years of work, training, and just pure stick-to-itiveness. And she is an ever-present inspiration to me when change on a larger scale seems futile and elusive. And while I believe that Sheray is truly a neighborhood and community hero, an everyday heroine of sorts, there are also many more individuals out there like her in need of support and resources, and to be given the opportunity to meet a need or address a challenge in their particular neighborhood. I hope this Meadowood Health Partnership can be a model for the future and other communities across the city and the county. So thank you all very much for coming and supporting Sheray and the Meadowood Health Partnership.